Now on the doctor's note, Hantavirus is making headlines. Last month and early this month, 3 people died from an outbreak of the Hantavirus on a cruise ship. The Centers for Disease Control and Prevention is monitoring 41 people for the virus. Here's a look at where people are being monitored, including here at home in King County. Public health officials are monitoring 3 King County residents. Still, there are no Hantavirus cases currently in the U.S. Steve is in the ARC Lounge with Washington Secretary of Health, Dennis Worsham, to talk about the virus and the risk. Steve.
Yeah, and certainly a lot of people have been talking about this around the globe and right here in the U.S. ever since we had this, cruise ship where we've seen some of those infected passengers. Let's kind of talk about what hantavirus is. What type of virus is this? What does it do?
Yeah, it's a family of viruses that predominantly live within rodents and rats.
Okay.
And it's can be exposed to humans, oftentimes through the droppings. People inhale it through, and it's like urine, feces, saliva of a rat. Or a deer mouse here locally is how it's transmitted here.
I've heard this example when it's been talked about, over the years that, say for instance, you're in a shed, there's been a mouse that's been in there, and sometimes you get some droppings, and you're like taking a broom and sweeping those up.
Yes.
Some of those dust particles or something is kind of what causes the spread.
Exactly.
Can it spread from person to person?
Yeah, so there are different strains of it. Of course, what we're seeing in the media right now in the national news is this thing called the Andes virus, which is one of those types. And it has been known to transmit from person to person. But here locally, what we have is mostly in deer mice, and it is not transmitted from person to person.
Okay. One thing I was going to ask you is we've obviously done a number of stories about this outbreak that's been happening with the cruise ship, and I've gotten a lot of feedback from people on social media saying this is the media that's trying to hype this up and make it sort of like another COVID-19 pandemic.
Yeah.
How concerned should people watching at home in Washington be about this virus?
Yeah, it is a really, really low risk for people here in the state of Washington.
Okay.
And so people shouldn't be alarmed. It is not, the interesting thing about COVID, right, and that's where people are going back to, is it was a novel virus. It was a virus we had never seen before, and it was transmitted airborne, and a lot of concern around it. This is not that. We have years of understanding the Hantavirus and how it's transmitted, and we have a lot of learning around this already.
So could there be a possibility of it elevating to something like what we saw 6 years ago with COVID-19?
No.
Not at all?
No.
Okay. But still be cautious or aware of it, I guess.
Right. I have to say, when public health works well, right, we can interrupt these transmissions, and this is one that we are between our organizations of the World Health Organization, CDC, our local health departments, our state health department, is we're able to monitor and interrupt this. This is really contained to a cruise ship. It's, a handful of people who were really exposed, and there are 3 people in the King County area that we're monitoring in particular. 1 was on that cruise ship, 2 were just assumedly exposed to somebody on a flight.
For people who don't know about hantavirus and are hearing about it for the first time, what are some symptoms? What usually develops?
Early symptoms are, unfortunately, just common flu-like symptoms. They generally feel nauseous, could have diarrhea, could just have body aches and pains. It's if you've been around cleaning a shed, deer, mice, or droppings, pay attention to that. Get some help. The challenge with this particular one is once you get into like day 8 or so, it goes right into respiratory illness, shortness of breath, and it actually moves very, very quickly and become very deadly.
Okay, and so is there like a testing mechanism within the first couple of days to confirm that it might be a hantavirus case?
Yes, so you can get into your physician's, test can be run. It's really important to let them know that you have been exposed to deer droppings, mice droppings in particular, and let them know so they can really zero in on the testing.
So say for instance somebody is cleaning up a shed, or we have some people that are going camping because the weather's getting nicer, traveling over the next couple of months. Is there some precautions that they can take? Yeah,
we oftentimes say because it's when you're sweeping, you're getting this dust particles that have been exposed to either the urine, the feces of the mouse. We tell them to really spray well with a disinfectant spray. Oftentimes, like bleach and water is fine. Okay. Moisten the area and then clean up and use a mask and gloves.
Okay, just to take those simple precautions
Yes.
when you're out and about. Anything else that people should know about this?
No, you know, I think what's a couple of points I would just want to make is we do not have the Andes virus here in Washington State or in the United States at this particular time. The people who were identified on the cruise ship are isolated, quarantined in places in Nebraska and in Georgia. The two that are here in King County right now do not have the virus, and they are complying to being at home. So extremely low risk to the public.
Okay, but certainly something to be aware about as we hear all these stories across the globe and country.
Yeah.
Thank you for sort of calming our fears this morning.
Yeah, absolutely.
I know there's been a lot of talk about it, and we're trying to calm some of those fears. Risk is very low. Okay,
Yeah.
Tyra?
Stay aware, know the symptoms.
That's right.
Thanks
Knowledge
so much.
is power.
Yes.